Have you ever looked at your body after 40 and thought, what happened? I'm eating the same foods, I'm trying to exercise, but suddenly I'm gaining weight around my belly and my blood sugar seems harder to manage. If you're a woman over 40 living with type 2 diabetes, you are definitely not alone in wondering what's going on. And today we're talking about something that doesn't get enough attention: the relationship between midlife hormonal changes, estrogen, insulin sensitivity, body fat distribution, and blood sugar. But here's something I want you to hear from me right away: your body is not broken. And weight gain after 40 is not a sign that you failed. There are several biological and lifestyle factors involved, and understanding them can help you make smarter decisions about nutrition, movement, sleep, and blood sugar management. By the end of this video, I'm going to explain what may be happening and what you can actually do about it today. And I'll give you 2 resources to help you get started. Let's get into it. Before we get into today's content, I just wanted to briefly introduce myself. For those of you who do not know me, my name is Carmen Walker, and I'm a certified health coach, life coach, and weight loss expert strategist for pre-diabetic and type 2 diabetic women. I was diagnosed with diabetic ketoacidosis back in 2020. I was discharged on insulin. I was 37 years old. I did not have any intentions on staying on that insulin because I understood the condition I was diagnosed with was something that I could work towards changing. Fast forward 3 months later, after being discharged on insulin, I went to my first doctor's appointment. I've been implementing small but very significant and consistent lifestyle changes that allowed me to be taken off of insulin by my doctor after just those 3 months. After that, my weight loss skyrocketed, and to this very day, I am still on my weight loss journey, and I am 95 plus pounds down. My hemoglobin A1C when I started was at a 10.6, and now it is well below goal and holding steady. I understand where you are. I understand the frustration, and I understand how this situation can impact your whole entire life in every area. However, I am also here to let you know there is light at the end of the tunnel, and I would love to help you get the same results that I've been able to get for myself and many other women who work with me on the daily basis. So let's get into today's content. Why does weight loss feel different after 40? One of the biggest complaints I hear from women that I work with who are in midlife just like you is the things that used to work aren't working anymore. Maybe you used to lose weight by cutting back on certain foods. Maybe you could skip a meal and feel fine. Maybe you could have a few nights of poor sleep and still function normally the next day. Maybe you could eat a higher carbohydrate meal without noticing a major difference in your energy or your blood sugar. But now, you may be noticing more abdominal weight gain. You may be feeling more tired throughout the day. Your appetite may feel different. You may notice changes in your sleep. And if you have type 2 diabetes, you may notice that your glucose management requires more attention. So what's happening? It's important for you to understand that aging itself, menopause transition, changes in your estrogen levels, loss of muscle mass, sleep disruption, changes in physical activity, and other metabolic factors all can affect your body. And they can all interact together. This is why I don't want you walking away from this video thinking it's all because my estrogen is low. No, it's more complicated than that. I also want to briefly talk to you about estrogen and your metabolic health. Let's talk about estrogen. During the menopausal transition that your body begins to go through after you hit the age of 40, estrogen levels can fluctuate and eventually decline. Estrogen has effects throughout the body, including on tissues involved in metabolism and body fat distribution. As estrogen changes in your body, women, all of us, can experience changes in where body fat is stored with greater tendency towards that abdomen and that visceral belly fat accumulation that happens in our midsections during and after the menopausal transition. So it's important to know that because abdominal fat isn't simply how your genes fit. Visceral fat is metabolically active and is associated with greater cardiometabolic risk. So not only can your belly fat feel uncomfortable and of course cause you to look undesirable in your clothes, it also can affect your heart and how your body metabolizes in general. So for women who already have type 2 diabetes, that can make managing your metabolic health even more important. But here's where I want to shift the conversation a little bit. Instead of saying my estrogen is low, so there's nothing I can do, I want you to think and say to yourself, my body is changing, so I need a strategy that changes with it. And that's where I come in. Not only is that statement empowering, but it puts you in a position to take action. And I can help you do that. Now, what about insulin resistance? Let's talk about that really quickly. Insulin is a hormone that helps your body move glucose from your bloodstream into your cells where it can be used for energy. So with insulin resistance, your cells don't respond to insulin as effectively. Your body may need to produce more insulin to maintain glucose regulation. And if you already have type 2 diabetes, insulin resistance is an especially important part of your overall metabolic picture. Midlife hormonal changes can occur alongside changes in your body composition, physical activity, sleep, and other factors that influence insulin sensitivity. So if you're thinking, why does my blood sugar seem harder to manage than it used to be? Don't automatically blame yourself. There may be multiple things happening in your body at the same time that can all affect this. So let's talk about the belly fat connection, okay? You may have noticed something like this. I never used to carry weight around my midsection. I never used to carry weight here. And suddenly your waistline looks different. This can happen during midlife as body fat distribution changes. But here's the important part. You cannot, please hear me, you cannot spot reduce belly fat. Can't do it. Doing 100 crunches isn't going to specifically remove abdominal fat. Instead, I want you to focus on the behaviors that support overall metabolic health. That means nutrition, physical exercise, strength training, getting enough sleep, being sure to control your stress levels. I understand stress in itself is very hard sometimes to manage and even more difficult, if not totally impossible to avoid. However, how you manage it really does matter. And also working with your healthcare team to manage your type 2 diabetes. And this is exactly why I created the Core 5 method. Now, this is what we talk about in the Core 5 method program, okay? It focuses on 5 interconnected areas: your mindset, how do you think about your body, food, and your ability to change. We cover nutrition, how to build satisfying, balanced meals that you like without relying on extreme restriction. We also talk about weight management, how to create sustainable habits that you can continue to do every day without feeling overwhelmed, and rather than chasing rapid results, we teach you the long game, because the long game is what's going to get you to your goals and keep you there. We also talk about blood sugar, understanding the daily behaviors that can influence your glucose patterns. And then we also talk about fitness, how to use movement and strength to support an active lifestyle. And I want you to notice something. None of these 5 pillars says eat as little as possible. No, no, no. None of it says stop eating carbs. They're evil. Don't eat any more carbs forever. No. And none of it says exercise until you're exhausted and you have nothing left. The goal is to create a strategy that you can actually live with. I did it for myself. I've helped many other women that I've worked with do the same thing, and I want to help you as well. So, here are 3 things that you can start doing. Let's make this thing practical. Step 1, you can start building balanced meals. Instead of obsessing over individual foods, think about your entire meal. Ask, where's my protein? Where are my vegetables or other fiber-rich foods? What carbohydrate-containing food fits into this meal? And what healthy fat could complement it? And remember, your specific nutrition, your needs may be different from someone else's, and that's okay. If you're taking diabetic medication, including insulin or other glucose-lowering medications like metformin or what have you, work with your healthcare professional regarding your individualized nutrition and glucose management program, okay? By no means is this video or the Core 5 Method program designed to give you medical advice, okay? I am simply here to help you work alongside your doctor to help increase your energy, improve your blood glucose levels, and to help you drop those pounds that you've been wanting to lose, okay? Now, step 2, we already covered building balanced meals. That was step 1. Step 2 is moving after meals. A short walk after eating can be a practical way to add movement to your day. Trust me, I know. You don't need a fancy gym. I didn't when I first started out. And you don't need one either, especially if you don't fancy a gym for different reasons. You don't need a 2-hour workout. Try making movement part of your normal routine. For example, you eat dinner, you go for a walk for 10 minutes. Walk around your neighborhood, walk inside your home, walk while talking on the phone. The goal is to make movement easier to repeat. Step 3, take sleep seriously. If you're sleeping poorly, don't treat that as an unrelated problem. Sleep affects your energy, your appetite, your mood, and many aspects of your metabolic health. So instead of asking, what supplement can I take for weight loss? Start asking yourself, what can I do tonight to create a better environment for sleep? Maybe it's a consistent bedtime. Maybe it's reducing your screen time on your cell phone or your tablet or your computer or your TV. Maybe it's creating a 15-minute wind down routine. Small habits can add up. Next, let's talk about what about your blood sugar, okay? Because this is a very, very big point of contingency for a lot of the women that I work with. Here's something else I want you to stop doing. Don't judge yourself based on one glucose number. A single reading is information. That's it. It isn't your identity. And if you monitor your glucose, start looking for patterns. Ask yourself, what did I eat? How much did I eat? Did I move afterwards? How did I sleep? Was I stressed? What happened to my glucose afterward? That turns blood glucose management into a learning process, which is what I want you to do. And please don't make medication changes based on a YouTube video, okay? Your healthcare professional should help you interpret your glucose patterns and help you make those medication decisions. So please go talk to him or her, okay? Do not use this video to change your medications on your own. Please consult your doctor first, okay? Now, if you're watching this and thinking, okay, Carmen, I understand what you're saying, but where do I start? I created something specifically for that. It's my 7-day blood sugar stability reset guide, and it's completely free to you. I designed it to give you a simple starting point for building more consistent habits around balanced meals, blood sugar awareness, daily movement, hydration, energy, and sustainable weight management habits. You don't need to completely overhaul your life. Just start with 7 days of paying attention to your habits and creating small, repeatable changes. You can find the link below this video for that free guide, okay? And if you are looking for an even deeper system and you're ready to go beyond the 7-day reset, I've also created the Core 5 Method Blood Sugar and Energy Reset mini course. It is fire and you're gonna love it. This mini course takes you deeper into the areas we talked about today. You'll learn how to understand the midlife shift, create smarter meals, how to incorporate practical post-meal movement, recognize your energy and blood sugar patterns, and develop sustainable habits. It's designed specifically around the challenges women with type 2 diabetes over 40 can face in their midlife season. So if you're tired of feeling like your body is working against you, then this is your next step. I'll also link that down below, okay? So let me leave you with this. You are not the woman you were at 25. And you don't need to eat, exercise, or live like you were. Your body changes. Your priorities change. Your hormones change. Your lifestyle changes. And your strategy can change too. So instead of thinking or asking yourself, how do I get my old body back? Start asking yourself, how can I build the healthiest version of the body and life that I have today? Okay? That's the conversation I want us to have here. If this video helped you understand why weight management and blood sugar can feel different after 40, be sure to subscribe to this channel because I'll be sharing more practical strategies for women who are 40 and up living with type 2 diabetes. And don't forget, download the free 7-day blood sugar stability reset guide. And if you're ready for the next step, be sure to check out my Core 5 Method Blood Sugar and Energy Reset mini course. Both links are in the description down below. And remember, your body isn't broken. Your strategy may just simply need an upgrade. Okay? I'll see you in the next video. Until then, stay healthy, stay happy, stay safe, and most of all, stay consistent. I'll see you in the next one.